to Pacer Nursing Power Hour, your go-to spot for real tips and real talk in the world of nursing.
So plug in, scrub up, and let's go. This is Pacer Nursing Power Hour, where students get powered up. God, I wish I could sing.
One day, we'll take lessons.
Okay, so, Keigans, we're on the struggle bus this week.
We are on
huh?
the struggle bus. You know what week are we? Is this week 7
I have
of the
no
semester?
No, God, I hope not, because then my course, I don't know. I did
I think
catch up
we're like
with a lot
6
of
or
grading.
7-ish.
Like-
and we're midway-ish. At least a third of the way in.
You know,
and I think we're doing the little...
That just brings another whole world of hurt on us.
Oh, no.
Mid-semester.
Oh, no.
Midterm grade.
Yeah.
Advisement.
Yeah, we're riding the struggle bus. Life has happened to both of us in the last week or so.
Big time.
Good.
Some of it. Most of it good. Most of it really,
but
really
as
good.
we always say, stress is stress. It can be good.
Stress is, but right now it is kicking me in the stomach.
Yeah. That's no fun.
It's motivating me to stay in bed now.
I love it.
I don't even want to get up. Like, I don't even want to drink wine.
Oh, man.
I know.
That says something. That speaks volumes.
Ooh, okay, we got to get back.
Volumes.
We got to get it back. Because we're going to run in a 5K this weekend.
We are. That is going to release endorphins.
We'll see. It's supposed
We're
to be
gonna
raining.
feeling
You know
good.
that?
Love it. I love when that happens.
Well, the good news is like high 60s. Like that's the lowest it's going to drop on Friday.
It's going to be great.
Okay, we'll see.
As long as Stella can survive it,
and
we're
as
good.
long as Sunny is my running partner.
Yeah, she will be.
Sunny
she's great.
is how
she's
old?
great.
8?
10.
10.
Mm-hmm.
That's
She'll
the
be great.
speed of me at 56.
I love it.
Jeff turned 57.
So you're officially younger.
Yeah, but then that just brings on that I'm about to be.
You're about to be. The countdown is on. I'm not going to lie.
Okay, we are genuinely excited. I know, we say that.
We are excited times 2 this week.
No, times 4.
Times 4.
1,000.
We have...
Okay, go ahead.
No, I'm not going to spoil anything, but I will add suspense.
Okay.
We have some great big things on the horizon.
Mm-hmm. Good conversation.
Good conversations.
A person that
we're going to interview a nationwide nurse, like well-known nurse.
Renowned. Yeah, absolutely. That everyone who practices now, like students may not know about this yet, but they will.
Yes.
Because it will come up at some point.
This person has definitely left a mark on the world of nursing.
Oh, definitely.
And
there's lots of conversation back and forth around this subject.
Yes. We are stoked about it.
Yeah, it's going to be awesome.
So in anticipation of that...
I nerded out hard when we...
Yeah, you did. I love it.
I want her to be my new best friend.
Yeah. Which hopefully everyone will see that. It's big things over the next few weeks.
Yeah.
But we wanted to start off by introducing a conversation about ethics, the board of nursing, what our role is as nurses, professionalism, and touch on some big topics leading into those conversations that we're going to have in the next few weeks, so that you have a little bit of background for those that don't know. And we even have learned so much. And we're still learning about like, oh gosh, I'm glad that hasn't happened to me yet. I mean, when you don't know, you don't know.
I know. It's crazy.
So every nurse at some point will face a moment where the right answer is not clear.
Hopefully they will understand that at that moment, with the lack of clarity of whatever's happening, they will do the right thing. Because that's the thing.
But the right things, there's a lot of times there's not a right thing.
Right. And it's like NCLEX questions.
Yes.
It's the better of the two.
Yeah, what's the best answer?
And, and it's hard to, it's great. You can beat Monday morning coaches. Is that the term?
I don't know. What you're about to say.
Monday morning quarterbacking all day long.
Yeah, true.
But when you're in the moment, you really don't know.
Hindsight's 20/20.
Yeah, and hopefully a cascade of events have not occurred yet.
Right.
Yeah.
Right.
Sorry, I say that because honestly, I am There's not a nurse that I don't know that probably is not guilty of just a little bit of
Right.
something.
Absolutely, because we are dealing with humans
Mhm.
and there's just no perfect answer all the time.
Mm-mm.
There's bound to be a
There
time when there isn't a perfect
and
answer.
there's a culture, and there's also a organization culture, which we're
Right.
gonna talk about,
Right.
that also has really not caught up to everything yet.
Right.
And a lot of organizations are being taken over by these corporate
Mhm.
companies, and the corporate companies are
Mhm.
the bottom line. So, we'll talk about that later.
So,
Anyway,
nursing and medicine in general, healthcare is very science-based.
yes,
I mean, we teach patho, we teach pharm, we teach med surg, and it's all textbook teaching.
yeah,
And then
and keeping
and
it
how many
current.
times in a class have you said, "Well, it doesn't always look like this,"
There's real
or
world, and
"There
then
was"
there's the book.
yes,
My
yes,
students say it
or
all.
"I had a patient that was diagnosed with this, but it didn't look anything like this," you
Yes,
know?
here, real world book. I mean, growth and
Yes.
development right there.
Oh
You
my
know,
Atlanta, yes.
like the CDC says, if they're not walking by 2, then bring them in. But I'm sorry, I'm going to bring my child in just a little bit sooner if they're not walking.
I disagree.
Yeah, no, thank
Yeah.
you.
We also are dealing, like I said, with humans who have their own opinions about their
They're
own health
flawed.
care.
We're flawed. We are. We ate the apple.
And I mean, but we do have our own voice of
We do.
what we agree to. So there's advocacy at play. There's your own personal judgment at play. And then there's accountability
Yeah.
also at play. So there's a lot of moving factors when it comes to nursing, and we're going to touch on those again. We have some big conversations happening over the next couple of weeks,
Hmm.
and so this is kind of like a pregame to the
Yeah.
next few
This
weeks.
is the mini course before the big course.
Yeah.
Even though there's no lessons attached, just pure
Yeah,
enjoyment. Hopefully, not enjoyment and learning and growth. Because I
absolutely.
really feel like that through all of this, when we're done, when all of this is done, that I feel like because I've learned
Mhm.
a
So
tremendous
much.
amount. Like I had no time to dig the hole that I did researching last week,
Mhm.
but couldn't stop
Mhm.
because I was like, "Oh my gosh."
Right.
So there's so much, and we teach our students, we try to teach our students, have a sense of responsibility, I'm teaching about professionalism online,
Mhm.
on social media. So we're trying to make them, and this guest said that one line, which we'll talk about later, but, we want you to be fully prepared, but sometimes that also it can be interpreted that
Right.
they know it all. We
Mhm.
know it all, and
Mhm.
in
That's not the
reality,
case.
you don't.
Yeah.
In fact, with Professor Miller, Amber, that we interviewed last week, we
Mhm.
talked about imposter syndrome and not knowing,
Yeah.
like, why
Just a
am I?
new role.
Yeah. So a lot of that, you still need to hold deep. Inside, accountability and professionalism are just key.
Mhm.
Um, oh God, there's
Yeah.
so much, so much.
So today we don't want to lecture on like ANA code of ethics. That's
No,
not our goal here. We're trying to make it more real world and give some real examples and
I
spin
did.
it in that light.
I did order a hard copy of the ANA Standards of
Oh,
Practice.
nice.
It should be coming in this week.
Well, I wanna read. You
Yeah,
you take a look, put
yeah,
your notes, and then I'll add
yeah,
my
yeah,
notes, and we
yeah.
can nerd
We'll
out
have some
together.
stickies all over that thing.
So, let's dive in and start with what nursing ethics actually looks like in real life. So, ethics is deciding what is right when there's not a perfect answer. I'm sure off the top of my head, I can think of tons of examples I've been a part of where you're like, "Ugh,
Hmm.
yeah, okay, well, the patient wants this thing, but that's not research based." And, like I can think of so many examples,
Hmm.
small and big,
Hmm.
where I've been a part of those. I'm sure you can do the same.
Yeah, way too often. I mean,
Yeah.
you and I have been sitting in witness boxes before. We've
Yeah.
been in court before, not
Mhm.
because of something we did,
Yeah, not for
but
doing
I
something
mean, we
wrong.
know that feeling.
Mhm.
And in reality, one of the issue cases I was involved on, was my fault. Like like I failed to document. I mean,
Really?
we preach
Mhm.
documentation, and I grew up in that world where you wrote everything, and so I wrote everything. And the fact that I left and omitted two words out of a sentence made a
Made a
difference.
difference. That's powerful, man.
And, in this day and age of EMR charting in the computer, it's
Mhm.
a click and go.
Mhm. Well, we're definitely gonna talk about documentation a little bit because that does play a big part in what we're about to talk about in the
Huge,
next few weeks.
huge.
Um, I actually wanted to start with the difference between laws, policies, and ethics because I think there's some gray areas
Mhm.
though, but the definition after looking them up, laws are what you have to do. I mean,
Right.
you have to follow the law, duh.
Mm,
Policies are an outline of what your institution says you need to do
mhm.
regarding something like in my world, we have a Pitocin policy, and that's how you
Medication administration
yes.
policies,
Mhm.
blood administration policy. There are restraint
Mhm.
policies. We can talk about restraints all day long
Yeah.
because if you don't have an order for a restraint, you can be charged with assault.
Mhm. So, for any future nurses, new grad nurses, I tell all of my clinical students print out all of the policies that apply to your area, whether
Yes.
you've used them yet or not, have them in a binder and carry them with you.
And
Like,
make
put them
sure
in your
you
locker, like,
keep up
have
with
them.
up to date because they review
Yes.
or
Yes.
an organization that's responsible should be reviewing those policies
Absolutely.
at least
You should
every
look at the
2
bottom where it says
years.
revised
Mhm.
2026,
Yeah,
look
yeah.
at those things.
Absolutely.
Yeah, have them with you if even if you do it on a regular basis, like in L&D, obviously we give Pitocin on a daily basis.
Yeah,
I would have that policy out
every time.
and
I
almost
didn't even
match
know
your documentation to it.
I didn't even know there was a policy on Pitocin. I thought it
Yeah,
was just the
mag
medication.
sulfate. There's
Oh,
another policy. And that's something you do fairly regularly, but it's not an everyday thing.
yeah.
I would say pull out that policy.
Or
Make sure you're
potassium administration,
mhm,
like, I grew up in a world where just something small,
mhm.
which, a drug we don't even give anymore,
Yeah.
Phenergan.
Mm,
We used to, give that IV,
mhm.
and, then we started seeing we were blowing out veins,
Yeah.
and so then we were seeing
Times
Phenergan's not a good
change.
drug,
Yeah.
and so it slowly faded out. So it really is. So, and then ethics is what
Right.
you should do. And there's also principles within that
Yes.
ethics.
Which is a great shift.
Yes,
I think 4 of the top ones there's a bunch.
there are. And I think these are the four that we really hone in on in
Yeah.
our ethics class here at school. And then what I've seen a lot,
In
even with like
practice.
city training,
Yeah.
I mean, there's a reason why we go through city training, which is
Mhm.
CITI, which is Um, I can't even remember what it stands for, but
Yeah.
you have to go through this training to publish
Yeah.
or to
You're
do a
gonna follow these.
research project. You have like massive, and there are reasons. I always say laws are made because someone
Right?
did something stupid.
They already learned this lesson, so let's, like, make a law to
Yeah.
try to make it not
So
happen again.
we have ridiculous laws, but they're good. But so
Yeah.
back to ethics. So the underlying
Yes.
principles that are most often talked about.
So autonomy, beneficence, non-maleficence, and justice.
Okay, every time I hear non-maleficence,
You think of Disney?
I see Angelina Jolie.
Yeah,
That is
with
I
the
don't know.
horns.
I mean,
I do too, though,
she was
and it
Maleficent.
makes sense. It does make
Never
sense.
saw the movie, just saw the
Really?
previews. Yeah,
Oh, it's pretty good. You should watch
I
it. You
still
should watch it.
haven't
I'm
watched
surprised I've
Wicked.
seen a movie that you haven't seen.
I haven't seen Wicked. You remember we've had
Oh
this
my gosh,
conversation?
yes. Okay, we're gonna just veg
No,
out one weekend, maybe
no.
this summer.
I need murders. Not
It's
Disney murders. Murder,
okay,
not
we're
Disney.
gonna we're gonna watch
So
it.
right
We
now,
don't have a
I'm
choice.
currently watching about the
Okay, if I can convince you to do a 5K, I can convince you to watch a movie.
we'll
It's gonna be fine.
we'll see. I'm learning about that British NICU nurse that was convicted now,
Okay.
Lucy Letner.
Okay. You have
Yes.
gone down a rabbit
Yeah,
hole.
yeah, I have. Big
So,
time.
autonomy is the right to make decisions for yourself.
Right. And
Um,
we've had this discussion too, because that's some of the legislation
yes.
that's currently in South Carolina. We
Mhm.
talked about that at
Mhm.
some
Yeah.
point, that nurse practitioners, 23 states have been granted autonomy. In other words,
To
they can make
practice
their
solo.
decision
Right.
and diagnose and not have to have a MD or DO
Mhm.
sign behind them.
Mhm.
So autonomy is massive, and nurses are given a good bit of it at work.
Oh, yeah.
I mean, I would suffice to say that
It's a good bit.
it probably shouldn't, there's
Which
some.
is where we talk about, scope of practice in a little
Yeah.
bit, and it is you have to follow that.
Yes, I was talking to someone about that's not your scope of practice, so don't know. Like
Mhm.
I'll remember it in a
Yeah.
minute. And beneficence, so
So the
always
next
get
2, I think yeah, 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 you do the same thing I
I
do, it
get
sounds like.
yeah, they flip back and forth.
Yeah, so beneficence is doing good for others.
Mhm.
Non-maleficence is
Not
not doing
or
bad.
not harming.
Yeah, not harming, yeah.
Yeah.
So, the example that automatically came to mind because my world is mother baby. So, doing good for your baby might not be harming your mom. So, like, a mom can refuse a C-section, but if your baby is decelling,
Mm,
you could hurt your baby by not hurting your mom. But if you have to get a baby out via C-section, cutting a mom wide open can be harmful to them. It can be. But then
yeah,
you're saving the baby's life.
yeah.
So in my world, those
And
definitely
that's an
play hand in
ethical
hand.
dilemma. It's a
Mhm.
massive
And like the mom, where do the rights of the mom?
supersede
Yes,
the
and
right.
vice versa.
Yeah.
So that is a conversation that we've had in my class
Oh, yeah, I just
many a time.
watched an old Law& and Order episode, or
See?
it was in the background
Yeah.
when I was grading, and it was someone went into, like, an, embryo freezing
Oh
center
yeah.
and destroyed, like,
Oh yeah.
8-year-old embryos.
Ay,
I
ay,
mean,
ay.
there's a lot of
There are.
conversations that we just don't talk about because
Mhm.
there's a, strong opposing sides, and
Yes.
as professionals in healthcare, we have to sit in the middle.
Yes.
You can
We're the
have your
middleman.
you can have your own thoughts.
Mhm.
You just can't, like, put it out on display
Yeah.
like some TikTok nurses did in labor and
Yeah.
delivery and talked about their icks.
Yes. Well,
That's in my social media class, so
yeah.
it's an example of, an ethical
Mhm.
issue. They clearly violated some law.
Right.
Alright, so go ahead. And the
Okay.
last one, the last principle of ethics.
Justice.
Yeah.
Well, I
So
mean,
that's my baby right there, because
okay, go for it.
you know everyone rolls their eyes at me because they know when I get
In regards to what?
they think I'm outspoken.
Mm,
I am, but I'm outspoken for things that have to do with justice,
justice. You're right, you do.
and I
That's a true
won't
statement.
let it go because
Yeah, you are like a dog with a bone when it comes to
it's like the 10-point
especially
grading scale.
students.
Yeah, I mean, I will go, and I don't know
Yeah, you go
if
down with a
that's
fight.
just in I don't know where that came from. I have no idea. My sister is the lawyer,
Yeah,
but and I think maybe for years of taking care of patients
yeah.
and having to be that, I mean, that's
Mhm,
what we say. We are an advocate for our
mhm.
patient.
Yeah.
And so I feel like I transfer that. I use transference
I
to whatever situation I'm in.
mean, that
So,
makes sense.
I feel like if it's the right thing to do, I'm going to do it. Now, did my nurse managers appreciate that? No.
No. They probably hate people
But,
like
I
this.
mean, there's a reason why we fight for the underdog,
Mhm.
or fight for what's right.
Right.
You've got to. And because people dismiss these principles of ethics, we just exist in a culture where that continues to be
Mhm.
okay,
Yep, it's a
and that's
cycle.
not okay. Okay, so
So, like examples of
next
each
one.
of these, autonomy,
Mhm,
examples would be like refusing treatment. We mentioned that.
mhm,
Leaving against medical advice or AMA.
mhm,
A patient at any time has the right to do that. And we have
mhm,
them sign a little paper and
mhm,
continue.
mhm,
There's also religious and cultural opinions and choices that play a role into healthcare. And then medication non adherence with which we've touched on a little bit,
The
in the
big thing
past.
right now is vaccinations.
Oh, yeah, yeah.
I mean, we
Good
have
one, that's a good example.
diseases that were eradicated
Mhm.
early in our 20th century, but now are nearing an epidemic,
Right,
um, because no vaccines.
right.
And, I can't even discuss vaccinations in peds because, you have the CDC,
Mm.
and then they decided
Say
to
one
drop
thing.
11. And so then the American Academy of Pediatrics said, well, no, here's our schedule.
Mhm.
And so that's a,
Which raises a lot of question marks and doesn't help the problem,
mm,
any of the problems. This is a multifactorial problem,
yeah.
and it just expands it
So I mean,
when these 2 overseeing bodides are like, "Eh, one thing, eh,
it's
another."
a perfect example of
Yeah,
autonomy. But
it is.
then you're pushing that into public
Mhm.
areas that,
Yeah,
you know,
definitely.
I saw a case that had there was some exposure in on one of our towns that we have a campus.
Uh-huh.
And so I sat there and I was kind of worried. I'm like, "Ooh." But then I thought, "No, all of our students have to prove they have the antibodies for
Yeah.
that disease." So I'm like, "Okay, I shouldn't be so worried." But still, it's starting to touch
Mhm.
areas that are closer to us.
Yeah.
So anyway,
Well, there's definitely a fine line, especially as a nurse, between advocacy and persuasion.
yes. Oh, that's a good one.
Yeah, thank you. Thank you. Um, it
That is really good.
I mean, that's like a fine line because we teach, educate, educate, educate.
Yeah.
My students this semester are tired of hearing me say educate
Educate.
3 times in a row. They even started quoting me in class. They'll be like, educate, educate, educate. And I'm like, yes. But where does that meet advocacy? We educate our patients all the time and then put the ball in their court. But then I feel like, okay, if they don't say the answer that the doctor ordered,
Mhm.
it's like, okay, well, let me re-educate you, you know? And so it's like, where do
Where
you
did the
find that
parents'
line?
autonomy take supersede what
Yes.
we are
Yes.
advocating and
Because
educating?
sometimes people do make choices based off of TikTok.
Yes. That's
And
the
it's not 100%
whole
correct.
whole reason why I developed an entire course on
Yes.
that.
So it does. I
I
mean, we
gotta
as
show you some of the stuff they found. Like,
okay.
I'm
Oh,
like,
I can't wait. Yay.
"Oh my god, they're really saying that?"
I
I mean,
love
it's
it.
really cool. But yeah,
So I
that
think it's really important as nurses that we do educate. Obviously, I'm a proponent for education, but if they still make the choice,
so I remember when, yeah, no, that'll come later. But
that'll come later.
Um, you know, kind of what just kind of sparked my mind is that, nurses had the autonomy to back in 1987.
Mhm.
It was when HIV and AIDS were
Mhm.
a thing,
Mhm.
and we treated it like it was the Ebola virus. And
Yes.
I
You
remember
wouldn't touch
I was pregnant,
patients. Mhm.
and I remember just freaking out about it.
Mhm.
Um, and they were allowing nurses to not have to take care of these patients. And
That's
I'm like,
sad.
that and what are again and again that was kind of disease scary because we didn't really know a lot about it, much like with COVID. We didn't
Mhm.
know about it, so we were reusing N95s on
Yeah.
top of a surgical mask with a
Yep.
surgical mask over the
Mhm.
N95. There were so many things we didn't learn. But then at what point do our inherent values
Yes.
bleed on to what we
Yeah.
say to our patients? Or
Yeah.
not even say. Sometimes indirect conversations or
Oh,
body
yeah.
language is it can really put them over the fence.
For sure. Yeah. So there's definitely, like I said, a fine line. And there's so many gray areas,
Mhm.
and that's why they're ethical issues.
That's what yeah.
And it's hard. It's hard being a nurse. It's more than just memorizing diagnoses and how to care for a patient and how often to take vital signs and when and what to report to your doctor and triage. Like, it's more than that.
Mhm.
It's more than what NCLEX will ever test on. And I think that is why you and I are so passionate about putting the work into this little room, and
Mhm.
doing this every week. I mean, you and I both didn't want to show up today.
No.
Both of us didn't want to show
I
up
wanted to
today.
stay in my
But
pajama bottoms
this
and
is
work.
exactly why it's important that we're showing up.
And we did. We
We
both were
did. We
like,
showed
"We
up.
gotta do
We
it."
put makeup
We
on.
we
That's big.
put a bra on.
That's big. I mean, seriously.
Although
I changed, I think, 4 times this morning because I was like,
I
"I
did
just wanna wear sweatpants."
I just knew I wanted to wear my new shoes, and so I'm
That
like
they're very cute.
and these Jeff had just and
Yeah.
they were in I'm like, "Alright,
That's it.
so
That's the outfit.
I'm done, I'm done." So we showed up because our sense of justice and our
Yeah,
sense
yeah,
of, needing this, wanting this.
yeah,
It's our I feel
absolutely.
like it's our ethical duty.
Ah, definitely. I like it. I like it. That's a good way to put it.
Mhm.
So beneficence, examples of beneficence versus non-maleficence. I gave one. Others would be like aggressive in the life care, which I mean, I think you've kind of mentioned stories like personal stories of
Yeah.
family members you've talked to me about where it's like, where do we draw the line
Yeah, we've
and
had family
provide
members.
quality of life versus
Yeah.
all of these treatments and really
I
is
mean,
that what they want,
and
you
for
know?
any nurses who've been a nurse for a while, have you ever been part of a slow code?
Oh gosh, yeah.
And that's it makes me uneasy to even say that.
Mhm.
Um, slow code is obviously not obviously, but someone made the decision. This person's old.
Mhm.
Let's just let him go out, you
Yeah.
know, not cracking 29 ribs.
Yeah.
You know what I mean?
Yeah.
But then I look at my mother-in-law, who is 85, had massive stroke right before Christmas last year. We were convinced, she was gonna live with
Seriously
us,
though,
and she is driving.
has made
Uh,
beautiful
and she's
recoveries.
still only on 5 medications
That's incredible.
at 85. You would never know she's
Mhm.
85.
Mhm.
And then there's, the other one in my life who is 88, not my life, but was, um, and just pitiful. Anyway,
Yeah.
so, I mean,
Amazing.
it's hard. It's hard. End of life care is always that topic of discussion
Mhm.
where are we doing them more harm by doing what
Yeah.
we're doing? Are we
Are we
doing it
falling into the beneficence and the non-maleficence
Yeah.
categories? Like, where are we, you know?
And in our essentials, for school, we're being reaccredited. Our school is up for reaccreditation. And one of the new kind of essentials, which is like the Joint Commission safety laws or, all of that, is the discussion around palliative care and end of life care. And
Which we have an elective end-of-life
we
care, which is, I've heard, very fascinating. It's
how
a
I
great
want to
class.
do it. I
Let's do
mean,
it.
she went on, Professor Jennings went to some big, like, massive thing during the summer last summer, and I can't remember what it was, but obviously it didn't make that. I can't remember, but
Yeah.
I remember being, oh my God, that's
That's huge,
incredible.
yeah.
Because I've always been like, there are two things I definitely am, not, or three things I definitely didn't want to be as a nurse:
And that was one of them.
labor and delivery, psych, and geriatric.
Yeah.
But I think as I get older, I understand it a little more, and it's really kind of
It
fascinating.
really is. I mean, it's a huge
But
part
there i
of the
there
life
there
process.
is an
It's a
ethical
significant.
obligation,
Oh, for sure,
for
yeah.
beneficence, non-maleficence.
Well, and I think that leads into our next little segment beautifully because it plays on the nurse day in and day out. Whether you work in the ER, whether you work in labor and delivery, whether you work in pediatrics, no matter where you work, you're going to at some point, unfortunately, experience moral distress, moral injury, and burnout.
So,
Hopefully, you
but
follow what we've already said.
yeah,
We've talked about these,
yeah.
like our little, what did you call it? Algorithm? What'd you call it? Red, yellow, green
Oh,
chart,
action plan.
action plan.
Mhm.
And you don't get to those extended circumstances like burnout. But these small daily choices and decisions and things that
They
you're a part
add
of,
they
they add
add
up.
to it.
Mhm.
I can't tell you how many times I've typed the words moral distress and
Really.
burnout.
Mhm.
Because it's not just about being overworked, physically
Right.
exhausted. It's the mental strain we
Mhm.
have upholding our autonomy,
Yeah.
our beneficence, our maleficence, and justice.
And I think but, like, we come home at the end of the day, and we've already made 1,000 choices
Yes.
as a nurse. In a 12-hour shift, an 8-hour shift, whatever. You've already made so many choices, even choices you don't even realize you're making.
Mhm.
Things like, "Oh, I don't have time to take a lunch break today."
Mhm.
A choice that you're just like, "Okay, I'm committed."
Mhm.
That's a choice.
How many times have you eaten walking around the ER
Yeah.
because the ER is just slammed, and
Yeah.
every time you got back to your cubby, you shoved a
Yeah, let me take a bite of my granola bar that's in my pocket,
I
half
would go get
scrunched.
popcorn and put some hot sauce on it.
That sounds
Does
so gross.
everyone says that, but try it. Oh my gosh, it's so good.
So
It's a perfect 3 a.m. snack.
and I think that's hard for loved ones and significant others
They don't
to
understand it.
understand.
They
You come
haven't seen
home
us for
and you're
14
they're
months.
like, "What's for dinner?" And you're like,
Mm.
"I don't care. Go find some popcorn and hot sauce."
Yes.
Like
I didn't eat dinner for,
Yeah.
like, all weekend long.
There are some days after
I
like,
just
in the ER especially, I would come home and I'm like, I'm just not gonna eat because I don't even know what I wanna eat right now."
and I'm so tired, and my
Mhm.
brain hurts
And I say these things not to scare anyone. I
or
don't want
dissuade
anyone to
from the
be scared
career.
from it, but I say these things so that you can prepare accordingly
Yeah.
and inform your significant others, your loved ones, your family, your kids.
A
You know,
love
like,
letter to my
yes, a love letter to my social life is
yeah.
perfect. That first episode we did, because it does play on you, and we want to create great nurses,
Yes.
and you have to mentally be prepared for it because you are these ethical choices come up constantly. Those choices of just day in, day out nursing
Yeah, it's
are
tough,
big.
and you don't realize the toll that it takes on you.
Yes.
Like, I told a story in lecture yesterday.
Mhm.
You know, you and I have both worked in the ER.
Mhm.
I've gone back and forth a few times because there are moments during because the ER is everyone laughs about ER nurses. Like, I talked about this the other day
There's
because
plenty of memes.
yeah,
Mhm.
and it's that meme with, like, no, ICU or NICU or
Uh-huh.
somebody that they're triaging and they come in like a
Yep.
hazmat suit, and
Mhm.
then you have
And then
an
the ER
ICU
nurse is
nurse
like,
has a cigarette, barefoot,
"Yep.
like,
Mhm.
not afraid, and that is us because, I
You
mean,
have to just dive in."
we don't know what we're
Mhm.
facing,
Yeah.
and, I said, there is a moment in time I had to because of a case, because
Mhm.
of patients that I had to care for that day, I said, "I can't do this right
Yeah.
now." I had to step back, and knowing where that line is very
It's tough.
crucial,
It's tough.
very crucial.
Some of the everyday ethical dilemmas that you might
Mm.
see as a nurse include witnessing unsafe
Now
practice.
we're not talking straight out diversion, we're not talking abuse,
No,
we're
no, no,
we're
no.
talking about simple things like not getting to that call bell right away,
Yes.
or not or giving a medication without scanning it. We're
Yes.
talking about, saying, "Oh, I'm gonna wait another couple hours to give this
Mhm.
medication."
Yep.
Like, how many times have you chosen
Let
with
me change the time.
at the yes, and you have
Mhm.
to put a reason,
Yep.
and the reason is nursing judgment
Yep. Yeah, it happens.
all the
It
time.
happens. Um, confidentiality. How many times do at the nursing station?
I mean, we struggle with confidentiality talking here.
Yeah, we have to really focus.
Yeah.
Really
I mean,
focus.
it is huge.
Yeah.
I remember I worked with someone who wasn't even she was there at work, but there was a extended family member, and she ended up telling another family member.
Yeah.
That family
That's what I
she
always think
violated for
about.
HIPAA, and
We
she got let go and
yeah.
fined significantly.
Yeah, we live in a small town.
Mhm.
The circles overlap
And
like
our
crazy.
guest, has to deal with this every, fear too.
Yeah, absolutely. So,
Hmm.
unsafe assignments, we've talked about
Hmm.
nursing ratios, even things like mandatory reporting. They play day in and day out on the nurse.
Mhm.
And it all compiles. It
We
definitely all compiles.
it builds up because we see that we failed.
Yeah.
I mean, I did at least. I felt like if I didn't do something right away or recognize,
Mhm.
I took it very
Yeah, like,
personally.
internalized it. Yeah.
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 I felt like I failed in some way. I felt like I failed every day because I felt like I never got above water.
And it can quickly feel like that, which is why we recommend things like talking to your family of ways not about patient cases, but about ways you can anticipate to provide self-care for yourself, you know?
Mhm.
But it takes that's a great, lead in to kind of the overlying idea here is as a nurse, you have to be courageous and speak up.
And that's not easy
It's
to
not.
do as
You
a
might
new
be
grad.
speaking up against a coworker, a friend. You can advocate for a patient. It can look like so many different ways, but it can be really, really hard
And, you know,
for
'cause I
yourself.
feel like I can say this because this probably won't be a long topic when we have our interview with our person, but she was talking about the crotchety old nurses who are mean to new
Mhm.
grads.
Oh my gosh, that resonated with me so hard.
I mean,
So
we
hard.
say all the time, even today,
Mhm.
we eat our young,
Yeah.
but in reality, it's not that perspective.
Yes.
I
Yes, that was huge. Oh my gosh,
the
like, it made me tear up when we were
So,
talking to her.
for a little clarity, we were discussing, seasoned nurses and new nurses, and all of the baby nurses are scared to talk up or say something because you have these senior nurses who are like,
"Rawr, rawr, rawr,"
yeah, blah, pipe down, like you don't know what you're
or
doing.
like, "You have to do it this way. You have to push it this slow. You have to"
Yeah.
whatever,
Put a
like,
sign on the door. I don't know, something's but it wasn't that they were necessarily trying to
be mean.
be mean.
Like,
It
"Oh,
was
you know nothing."
because they've done it,
They've
they've
been there
been
and done
there,
it. They've made the mistakes.
and sometimes they don't know how to talk up,
Yes.
as
Yeah.
gently as it could have been.
Well, and, like, rightfully so. You obviously don't wanna go in and be like, "Oh, I've made all these mistakes as a nurse, and I'm precepting you," you know? Like,
Mhm.
so it can come off very rugged and
I
harsh.
remember when I went to peds for the first time, I was still, a very seasoned nurse, like
Mhm.
25, 26 years. And my preceptor, God rest her soul, she's passed away since then. Um, she worked me to death.
Mhm.
I was like, "Are you serious?" She
Mhm.
goes, "No, go back in there, and I want you to clear that pump and come
Mhm.
back." I'm like, "We can catch it in 2 hours."
I actually, I came home from my orientation in the ER. You know who my preceptor was, and I adore him. I still talk to him whenever I run into him. We're like, "Oh, let's go grab dinner." You know, he's just like he's a true friend now. Um, respect him very much. But I came home crying one day from a 12-hour shift, and it was all over the tube colors. He was adamant
About
that
what
I
order?
knew no, that I knew the color tube, what I was drawing without the sticker.
Yeah,
And
you
I was
should.
so mad because I was like, I'm going to print out the stickers. It tells me the color and it tells me what the tube is. I don't need to know what the tube is
Yes, you
before I
do,
put the
because
sticker
you need to
on.
know what to go grab.
Yeah, I came home crying because all over tube colors. And I get it. I mean, of course, hindsight 2020. I
Yeah,
get it. I
yeah,
get it. But he was just, and he was never, like, he never ate me as his young, like
yeah.
he wasn't like that. But he
He
did. He
harped
had
on it, yeah.
his, he was rigid in his ways. And that was something he was passionate
Yeah,
about me
I love
knowing.
that.
So I'll have to text him and be like, what happened to you? Like, what's your story that made you so
So
particular about this?
there's
Yeah.
another member in that ER who's still there who worked with me the first
Hmm.
time I worked in that ER. Watched Claire and Katie, my children,
Hmm.
grow up. They
Yeah.
feel like they call her auntie.
Yeah.
She's still there, and everyone is scared to death of her. I mean, I'm not gonna lie. She scared the snot out of me when I
That's
first started,
hilarious.
but she knows.
She knows her stuff.
I mean, she can work circles around
Yeah.
physicians.
Yeah.
But I love her so much.
Well, there's definitely the reasons that I think people don't speak up: fear of retaliation,
Well, yeah, and being new also, being a new
Yeah, there's a
graduate.
hierarchy,
Yes.
and being a new graduate or a new nurse or even just a seasoned nurse in a new area
Mhm.
or a nurse that's worked in one hospital ER for years and years, but then you shift to a new ER and the dynamics, you just feel like you're kind of low man on the totem pole.
Mhm.
And that's difficult to kind of swim against everybody else and speak up and say
I
something.
remember when I first was orienting in one ER, I was still a baby nurse, probably 3, 4 years old. Now, when we say 3 or 4 years old, we mean we had been a nurse just for that long. When
You
I was
mean
a
you weren't
toddler.
practicing when you were a toddler?
No, yeah, no, that's why I look so young.
But your nurse
Nurse
life,
life.
you were a toddler. Got
And
it?
I remember this nurse, we had to cath a baby, and
Mm-hmm.
he kept reinserting and using the same catheter. And I remember I still very clearly
You
can
vividly see it.
see this, and
Mhm.
I'm like, that's not right."
Mhm.
But I didn't say anything.
Yeah.
But I went and did it myself correctly,
Mhm.
hoping that a child didn't get a UTI.
Yeah.
But, it's
Yeah.
still very familiar. I didn't feel I was still 3 or 4 years. I had
Mhm.
been a nurse. I had worked in a level 1 trauma hospital
Mhm.
in the recovery room, saw like hundreds of different things. I knew how to run a swan, do a cardiac out. I mean, like I knew a lot, but I didn't feel like I had
Yeah.
enough say so,
Yeah.
no,
Your
or
voice wasn't big enough.
yeah. So I didn't say anything.
Yeah.
Nowadays I'd be like,
Yeah, I can't even imagine you
let's
not
back
saying something,
this up.
"I love you." But I
Like
can't imagine it.
when I worked on peds and I was called down to IR to come give birth ed
Uh-huh.
to a kid on the table, I'm like, "Absolutely
Yeah.
not.
Yeah.
I can't stay there.
Mm.
Y'all gonna monitor 'em? No, we don't have a nurse." "Okay, well, then bring them back up and say you can't do it."
Yeah.
But then the nurses go, "Oh, we do it all the time." I'm like, "No, you don't."
Don't tell me that.
Like, I
Yeah.
question even to this day
Oh,
when I
I know.
go and I see, like, like a versed order on an MAR on like, this is not a sedation unit,
Yeah.
like, I don't
Hello.
not even a member of the staff
Yeah.
anymore, but, they've changed policies and blah, 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 but still, I it's still very it just
It's
hurt
ingrained in
because
you.
I feel like it's the culture.
Mhm.
It's the culture, and because of the way things are occurring in this day and age of short staffing, so many nurses left after pandemic. The pandemic did scar
It
us,
changed
and
nursing.
I am sick of blaming everything on the pandemic. I'm now choosing to view it as everything we learned,
Mhm.
and there was a lot of
It was a big
issues.
shift. Mhm.
Mhm. Yeah.
Well, practical tools you can use as a
Okay, now we're gonna
nurse.
argue about this. Not argue, but we're gonna have a dialogue about this. Go ahead.
Okay. So, practical tools you can use on a daily basis as SPAR
And we teach.
in your communication,
Yeah.
whether it's with a provider, if it's your shift change report, using
It's a
SPAR.
tool to
Yeah.
include
Mhm.
pertinent and relevant
Information.
information to a
Mhm.
provider regarding but then I have noticed, especially in school, so SBAR is
Situation,
situation, background,
background.
action, and then recommendation. When we get to the recommendation part, at what point do you feel comfortable saying, "I think we need an MAR or MRI," or "I think this patient needs CBC"?
What do you mean? I think I'm confused.
Okay, so as a new grad, you don't know what to recommend yet, right? You don't know what you
I
should
mean, I
do,
think you do to an extent.
but do you feel comfortable doing it?
No, I'm not saying you feel comfortable,
But in
but that's
reality,
what our goal is. That's what clinicals are for. That's what these AI conversations are for. That is what SimLab is for.
yeah.
We try to give experiences, but yeah, until you're flying solo on your own, it feels very different in
And the
that
first time, do
atmosphere.
you remember the first time? So back in, when I was a nurse, if you had to call a doctor in the middle of the night,
Oh yeah.
I threw up the first time I had to do
Mhm.
that.
Yeah, that's hard.
It's hard. It's
Yeah,
scary, and your
it is
voice
scary.
wobbles.
Yeah.
But nowadays you can't take telephone orders over the phone, right? Can you?
Yeah.
I don't know, I've just the last part of my life, I've always been in an academic, but I thought that telephone orders went away.
No, I think you can still take verbal orders. You just put verbal orders, and I always put a note like, "Called Doctor So and so. This is the report I
Okay.
gave. This is what I was told."
Okay.
Yeah, and then they sign off on them later.
Oh, no, it's telephone orders are okay. It's verbal orders standing next to you. It's that.
Are you sure? We
Never
need to
mind.
fact check that.
Okay. Yeah, we'll get
Yeah,
back
we need
to
to
you.
fact check that
Or if any of you practicing right now, tell
because
us.
I think that happens all the time.
But if they're standing right there, they can go find a computer and put the order in.
We'll fact check.
And I think we're thinking of different situations, not emergent situations.
Yeah, no, I'm not
Yeah, like if they're rounding, they'll, if a physician says
because they still have to sign off on any order you put in,
yes. So then
no
that
matter what kind of
leads
order it
to
is.
should you give it before it's profiled and before the physician is signed?
Now, I think those are great questions,
Yeah.
but I don't know as a fact whether people still are allowed,
And how do you
should or should
write a
not.
VO? I mean, I know you can in the computer. You just
Mhm.
put the physician's name and they sign. But again, what
Is that best practice?
is
I
that your
think
scope? Is that
that's the
within your
point.
scope? I think that was kind of a gray area that was in hot topic discussion.
So we'll fact check
Yeah.
that. You wanna take cuss statements?
Cuss is CUS.
Concern?
I'm concerned.
Mhm.
I'm uncomfortable. I don't feel it's safe.
Yep.
Now, this is where when I first learned about teams, these are actually tools out of a trademark, uh, what is it called? Not publication, but program
Okay.
called Team Steps.
Okay.
And it's
I didn't know that.
designed because the majority of all the errors in a hospital revolve around communication.
Yeah,
I
that's
mean,
I'm
most
I
all
would say
I
that's
don't
true.
know the statistic, but I know that that is factual. That's a lot of the conversation. And so hospitals started adopting these team
Mhm.
steps, and part of these are an S bar, cuss, and then there's other things that go like aid
Ate
it.
it.
Yeah.
Yeah.
And so but no matter how many times we taught it during hospital orientation, it's
When have you
never
ever heard someone
it's
say that?
never done.
Yeah.
Never done. No one
Mhm.
says I've seen 2 nurses. One of them was one of our former nurses. I think I've talked about this. She said, "No, I'm not giving this antihypertensive." She stopped, but I have never seen one aside from me because I'm me. But you don't do that.
Yeah. So I was in a situation where there was a new Pitocin policy that was released, and I will just say it didn't follow the typical physician
So,
orders.
what would be a typical like?
I'd have to pull the
Is it
policy and
under?
give you the exact details. It's been a few years.
Is it an underdose or overdose or
So it basically was if you didn't have a perfect baby, perfect, absolutely perfect baby, which in reality,
no baby's perfect?
yeah, like I mean,
There's no
there's
normal.
periods of sleeping where the strip can be not quote unquote perfect.
Perfect
Yeah.
because they're sleeping and not
Yeah, but
moving.
you can assess that
See,
and
even I
use
understand that.
reasoning, yeah, that I have a healthy baby. It's just in a sleep cycle.
Yeah.
So there are situations where the strip isn't quote unquote perfect. And the new policy essentially stated that you cannot up your Pitocin if your baby's not perfect for a certain period of time.
Wow.
So it really slowed down the
Yeah.
increases in Pitocin, which that could be a whole segment on itself.
Yeah.
Um,
And again, that could
but
bring up some ethical issues
it
within the
does
nurse if
bring
you
up
know,
ethical
especially if you
issues.
know
Yeah.
deep down in your soul.
So this one provider, very seasoned provider, um, I had to go head to head. And it was a situation where I literally printed out the policy, highlighted the policy, and I was like, I'm sorry. I understand where you're coming from. I understand what we've always done.
Mm-hmm.
And I'm not arguing that you're wrong.
Mm.
I'm arguing that I'm not doing this as a nurse. I'm happy for you to go in there
Yeah, absolutely.
and do whatever you want to do. But my computer's going to be logged out and you can document however you want to document. It was just
And
one of
if
those
you
situations.
don't know how to scan, I don't know.
Yeah. And you've never scanned a med, so I highly doubt you're going to go against this. Yeah, so it did. It came down to me actually having to stand up for that, but I wasn't, and again, it wasn't a conversation of whether or not I agreed with the policy. There were actually a lot of things I didn't agree with the policy,
Yeah.
but I wasn't going to go against the policy. I wasn't gonna
No,
document,
absolutely. We
you
know you
know?
know better than to go against the policy.
Yeah.
Now, I'm gonna give you a flip of perspective because
Mhm.
I had in my experience, I had a patient that I was you know how in the ER you have mid shifters, you have
Yeah, yeah,
various
yeah, yeah.
so
Mhm.
you can
Overlap a lot.
yeah, you can receive patients from another
Mhm.
nurse in the department because they're
Yeah.
leaving or whatever. So I was taking over a patient for a nurse and this patient was there, I think, for chest pain or something, and that we had just given him, like, some nitro or that nurse had given him 3 or 4 nitro.
Mhm.
No blood pressures were charted, like and I felt uncomfortable
Taking that patient over.
taking that patient over
Mhm.
because I'm like, "If they crash, they're gonna crash on me, and it's gonna be on me."
Mhm.
And so, the one time I remember, I think one of the first times I ever spoke up for myself was for this, saying, "I don't feel comfortable taking over this patient
Mhm.
because I don't
Mm.
have" I mean, we had monitors, yeah, but unless you
Set it, right?
specifically said
Mhm.
it, it
It's not gonna
didn't
just magically go
go.
off, yeah.
So there were no and nitro, you I'm sorry,
Yeah.
you need to take some vital
Yeah.
signs.
Yeah,
I mean,
definitely.
maybe not a temp, but for sure our
Mhm.
heart rate, pulse,
Yeah.
blood pressure. So I did find the courage, and I mean, I was
You
right
spoke
not to
up.
do it. Yeah, I was right not to do it. It was a big thing.
I think as a newer nurse, until you're in that situation the first time, you don't know how you're gonna react,
Mhm.
and there might be a few times where you look back and you say, "I shoulda reacted differently,"
Mhm.
but when you do react a certain way and you're like, "Man," you have that same outlook that you had, like, I stood by my gut, like, I
Mhm.
trusted my gut, and I vocalized it, and I know I was right. Until you have that experience, it is hard to gain that confidence because once you do it once, then you're like, "Okay,
Yeah, that
I
gave
didn't
me
get
a
fired. I didn't, like,
yeah.
none of these bad things happen that I'm scared of, and it's okay. It's
Now, have you
okay."
ever spoken up and been wrong? Not totally, but to some degree. I have. And I'm like, "Okay, you proved your point."
I mean, I'm sure at some point, nothing comes to mind, but I'm sure at some point.
Well, I mean, that whole like, there was an order for to give a certain amount of Versed
Mhm.
for a patient. I'm like, "No."
No.
I mean, that's, we're leaning towards, conscious sedation,
Mhm.
and I feel comfortable, and so I was saying,
Yeah.
"I don't feel comfortable." And so the managers had to get involved and they did bring and the educator had to come up and that I used to
You're
work
like,
with. They're
"Okay."
like, "We changed a few things." I'm like, "Okay, but show me the evidence where it's okay."
Yeah.
And they did. And I'm like, "Okay, I own it, but someone's going to watch my patients for a couple hours
Yeah.
while I take care of this and
Yeah.
do this on the floor that I don't feel comfortable with
Yeah.
because we're not a sedation unit. But still, you have to own it too.
You do.
So, in that respect, you do fight for what
Mhm.
you feel like is right, whether you end up being not so right or absolutely right, because
Yeah.
it's going to make everyone pause and take a sec. That's the entire reason
Yeah.
why timeouts
Happen.
happen,
Yeah, that's why they're there.
is because everyone needs to know.
Be on the same page.
Yeah.
Well, I think that leads us in to really a huge part of this episode and something that we learned
Oh, big
a
learning curve.
lot
Big learning
about is the
curve.
board of nursing.
Yeah.
And you can tell me whether to edit this next sentence out
Okay.
because I'm kind of nervous saying
No.
this. But the board of nursing exists to protect the public and not us.
No. And
And I think that was just a
that was shocking for me because I'm like, "It's the board." Like, it's
yeah,
our
like the board
people.
of nursing.
But if you look at the
Yeah,
website
you
that
go read, like you
it's
do.
the
It's not
labor
like they try to hide it or anything.
it's the labor department.
Yeah.
So, I mean, yeah, most of the people that are on the board of nursing are
Mhm.
nurses. But again, they're there just to make sure there's
To
no
protect the
harm.
public.
They're not protecting your
Yeah,
license.
no. Yeah,
They're
no.
protecting the patients within the state.
And
That was
nowhere
shocking.
ever has anyone told me that the Board of Nursing is for me. No one has ever told me that,
No.
but we're used to submitting our licensure to them.
Paying to renew
Paying like,
every
yeah, like,
making sure
"Go
they have
nurses, let's go another 3 years," like,
continuing education.
yeah,
Well, I mean,
continuing education, those kinds of things that they hold you accountable for,
which
and I
makes sense
guess
because I remember when they first started it, we're like, "We're working full time."
yeah,
Wouldn't
that's
that
experience, yeah.
but I understand that now because we need to keep up with evidence-based information, and it's to not harm our public.
So just to clarify this for all of our listeners and ourselves, the Board of Nursing is a state regulatory agency. So there is a different Board of Nursing for every state,
Yes.
and you have to follow each state's guidelines because
Yep.
they can be different. They issue and renew nursing licenses, which I'm the only thing I can think is that is why I thought they were for nurses, like pro nurses,
Yeah.
Because I mean, they're the people I reach out to, especially with my FNP. I don't think I did anything with the Board of Nursing before my FNP, but with my FNP, I was like emailing people like, "Hey, did I submit this right?" Or, "Hey, can you double check this for me?" And like make sure, because there were just so many question marks throughout that whole process, starting as a new grad for my FNP.
Yeah.
And that's who you emailed.
Yeah. Yeah.
So I think that's where my brain was wrong. They investigate complaints, which we will dive deep into on
Oh,
another
yeah. Big
episode.
time, big time, big time.
Um, and they discipline unsafe practice.
Yeah.
So your license is a legal
That
privilege.
that that is an understatement. Like, I did not
Yeah.
that is not how I feel like me passing the
Yeah.
boards, passing that NCLEX,
Like that was victory. I'm good.
yeah,
No.
I have that privilege of being able to
Yeah,
practice it.
but it's a privilege.
It
Like it's not permanent.
Yeah. That's why you put RN behind your graduate degree.
Yeah.
You put your degree first
Mm-hmm.
and then RN, which
BSN, RN.
it drives me crazy when I see it the opposite.
Oh, I always do mine wrong. I always have to look up all my letters and
Because
be like, "What's the
well, you
right
have
what's the
too
right order?"
many. I only have 5, so it's fine. I'm
Oh my
not
god.
confused yet. But you put your degree, once you earn it, you can't ever have that taken back.
Yeah, your degree,
Your
your
degree, your
education,
education, that
not your
diploma,
license.
so that
That can be
RN
taken
can
away.
be taken away.
Yeah. And again, in
When
the
I
next few
learned that,
episodes,
I was like 10 years I'm like 10 years old knowing that.
yeah.
I did
So
not
love
know
it.
that.
Yeah.
I was like, "Holy cow." And
Yeah.
so now when I see someone write RN, BSN, I'm like, I didn't teach you right.
I love it.
Put
Yeah, no,
that
I
degree
always have to look
first."
mine up and get it right.
And what also drives me crazy is people put every single undergrad degree.
Oh,
Now, if
yeah.
it's something other than nursing, yes,
Yeah.
absolutely. But if it's like ADM, BSN, MSN, DNP, don't you just list your highest degree. That's it.
Yeah.
The rest is a
It's an assumption. So the Board of Nursing is
they're
not
not your friend.
they're not your friend. Yeah,
I mean,
in summary,
they
they're not.
are. I mean,
Yeah,
they're good, but
they're a resource.
they're not there to say,
Protect you.
"You're here."
Yeah, they're not your employer.
Nope.
They're not your HR department.
No.
They are definitely not your legal defense. And they are
No.
not there to protect your job. They are there to protect the people, the patients. They are a form of public safety.
Yes.
So, some of the top reasons why nurses get reported to the Board of Nursing.
Okay, so but why report it? Why I mean, if they don't do okay, so they're
Mhm.
reporting actions of a nurse because there's some concern
Yeah.
about their
Public
practice,
safety or
public safety.
patient harm or patient neglect or patient, something
So
that's
there's
not
a
best for the patient.
standards of practice for
Yes.
each state that the
Mhm.
board holds you to. So
Right.
you have to meet those.
Right.
And
And you
that's
can
what
look them
I've
up. You
ordered.
can look them up online, yeah?
That's what I've ordered. I
Beautiful.
can't wait to get it.
It's so fun. We're
I
such
know, I
nerds.
know. Learn that hard. All right,
So
so an employer can report you.
yeah, big, remember that. Patient and family
Yep,
can submit complaints that
yep,
would then get investigated.
yep.
That's another one to keep in the back of your noggin for the next couple of
It's like
weeks.
calling a pet call or rapid. Anybody can
Mhm.
call it.
Mhm. A coworker can
Mm.
report you.
And yeah, that's a lot with. because you can read all of this. They
Uh-huh.
make it public
Yeah.
for the public.
Uh-huh.
You can read it,
Yeah.
and I see a lot of diversion
Yeah, that's
by
well,
coworkers, like
yeah,
people who are stealing narcotics.
it's crazy.
First of all, how could they work? I mean, I love a good Versed
I
push.
would be like,
I mean, Versed is awesome, but it
you know,
also I couldn't function.
yeah, no, I could not. I'd literally do nothing.
And
So
opioids make me
if I,
nauseous.
like, licked something, I would be on the floor.
I mean, I Versa's good, but I always say, "Start with 2," and we'll go with that. They're like, "No, you weigh, like, 10 pounds." I'm like, "Start with 2."
I can handle it. You
That's
can also have self-reporting.
the worst patient ever. Yes, and a lot of that is done, in criminal charges now, that just depend and through criminal charges,
Mhm,
so
mhm.
these 2 kind of play
Yeah,
in each other. So criminal charges, those are the big ones, those are big felonies, those are the big ones. Now self-reporting other charges, I learned this through, when my sister was in the DA,
mhm.
like DUI, like, where you literally had to do something, those are the ones that are
Yeah,
self-reporting because again, they need to determine or, like, if you got so many points on your license, you
right,
you have to report that as well because they need to determine if is that gonna bleed over into your nursing practice.
right. I think a key point
Mhm.
is that any way something gets reported, that doesn't necessarily mean the nurse intended to
Yes,
do harm.
and that there's gonna be
We're
disciplinary
humans,
action.
we make mistakes,
Right.
and mistakes can happen. The Board of Nursing is, I mean, obviously, you don't want mistakes to happen, but it is known that we are humans, mistakes happen, but you should report any
Yeah.
mistakes, whether it's you, a coworker, a patient, like they should get reported.
My dream is to serve on the board of nursing
Oh, that's a cool
before
dream.
I die.
I think you could do it.
I've
I think
asked,
you could do. You've
I've filled out application like,
yeah?
you can
Yeah, you can
self-nominate
mhm.
for or
Keep doing
whatever.
it.
So, I
Keep
don't
doing
know,
it.
but I met a board of nursing member, a higher board of nursing when we had that panel discussion that
Oh,
involved
yeah, cool.
Dr.
Cool.
Hopla.
Well,
So
common reasons.
practice reasons why we're disciplined.
Yep.
We as in nurses or nurses,
Yeah.
including APRNs,
Yes.
LPNs.
Yes. Medication errors.
Yep,
I'm sure that one's pretty common. Wouldn't you think?
absolutely. It
I
has to
think that
be.
one's pretty common.
Yeah.
Um,
These again all relate to standards of practice.
yes. Failure to monitor or assess,
Now, that's an ambiguous statement.
and
Again,
typing a nursing note saying continue to monitor doesn't count. You would
yes.
have to document an assessment. You would have to document vital signs. You would have to be detailed.
And
Yeah,
those
that
are
doesn't count.
specific because that is vague,
Yeah,
but also it also goes down to also bringing in the organizational policy for
right.
that.
Following the policy
So
for sure.
that's what they're looking for too.
Mm-hmm. Ignoring something that's concerning. If
Mm.
you notice a change in a mental status,
Or
if
a
you notice,
hemoglobin of 3 that went
yeah,
on for 5 days, you know?
mhm.
I mean, that's
If
a big
you
deal.
don't report things like that, and
This one's
yeah,
good.
practicing outside of your scope.
This
Hopefully,
gets scary.
hopefully that's not a big one. But yeah, we were just talking about it. Mm, again, it's like a gray line. Like
Very
you
gray.
can ask for things, but you can't put an order in and be like, "Oh, hey doc,
Yeah.
you ordered this," like
I
that. You
mean,
can't do that.
like, I do remember calling a doctor in the middle of the night when I was working in the ER going, "I need some admission orders." And it was 3 a.m.,
Hmm.
and he couldn't
He was
remember
like,
stuff. I'm like, "Don't you want a diet?" He's
"Yeah,
like, "Yeah, them this, don't you wanna just add some Tylenol in there in case they spike a fever?"
yeah,
He goes, "Just finish writing it for me." I'm like, "I mean, I can, but I'm gonna need you to
yeah."
say
I
it,"
I need you to like say yes.
We can go through all the
Yeah,
prompts, but yeah, so
and it's tough.
and knowing your scope is important,
It is
and
so important.
and I talk about this too, like, there was a time when I worked in a job where we had to clearly define and put out education regarding scope of
Hmm.
practice for nurses, LPNs,
Yes, I
paramedics,
was just about to say it goes
and
the other way too. It's
nursing
not just reporting to
assistants.
your provider.
And something is
Delegation and assessment. There's certain things that only the nurse.
right, like LPNs can't push IV
Mhm,
drugs, they can't do initial assessments.
mhm.
Um, Nursing assistants, shockingly, their scope of practice is not defined by the state, it's defined by the organization.
Very fascinating. Fun fact of the
Yeah,
day.
I know. I
Huh.
mean, that was painful to find out. There were
Mhm.
many calls I had to make, but I found that
But I
I was
fact checked it.
I was proud of myself.
Yeah,
I was on a hole because that was, I had to create this education.
that's
Because
wild.
it is scary. We are so good of walking that fine line.
Mhm.
And I think that's the whole premise
Of this.
of all of this.
Yes.
Because, like, the first thing that I did when I got home from that day of me going into the hole and we
Rabbit
had
hole,
our
yep.
first
Mhm.
conversation with our guest, I sat with Claire and I said, "Don't you dare do this.
Yeah, as a
Don't you
new
dare
grad
do
nurse. Oh
this.
my gosh,
Don't
yeah.
you dare,"
I didn't even
because I
think of
know
that.
your personality, I know your mouth, and you've been in, the ER for 7 years as a tech,
Yeah.
so you know
Yeah,
things.
you have
I said, "But I'm gonna
experience.
need you to pipe down
Yeah,
and pay attention."
reel it in.
Yeah, I mean, that's how
Ay, ay,
scary
ay.
I am for her.
Well, that might be where, like, professional conduct comes into play, and common reasons that you would be reported related to your professional conduct would be boundary violations.
Mhm.
Like, reaching out to a patient via social media would be a
And,
no-no.
oh my gosh, how many pictures of patients, especially in peds,
Oh, yeah?
this really bugs us.
Mhm.
And I will say I have seen other nurses report other nurses that they work with because of this.
Mm.
I mean, we have a very strict policy in the School of Nursing. You don't take a picture in
Mm-mm.
that your clinical arena.
Mhm.
You know, I always took that last day picture with my
Yeah.
students, but we were either at the doors on the other
Right.
side or somewhere else
Right.
where there's no patient information. In fact, that's another purpose of this
Yeah.
social media course that I have is
Yeah.
that one nurse during the pandemic like just said she was inside the hospital walls begging for more staff. They fired her because she was inside the hospital walls.
Mm.
So, it's a little scary.
Yeah, so there's definitely social media violations, HIPAA violations, substance impairment. You obviously, I mean, I say obviously, it's obvious to me, but apparently others don't understand. You can't come to work drunk.
Or from the night before
You
either.
can't come, yeah, hungover.
You can't. So, I had a nurse one time, I was a manager in a smaller hospital in a different city, and patients kept complaining they smell alcohol on this nurse's breath. So, I had to pull her in. We had to do, drug testing, alcohol and it was clean, and it was because every time she went into a patient's to start it, she would pop a Listerine.
Oh
You remember
gosh.
those
Yeah.
paper things?
Yeah. Yeah.
Listerine is a mouthwash,
Yeah.
and she was a smoker, and so she would pop a
Oh,
Listerine,
so it
and it
smelled like
smelled like
alcohol?
alcohol.
Interesting.
I know, right?
Weird.
And again, if they don't but see, I don't act right sometimes.
I hope you never get reported.
I know, I know.
No, this is just her baseline.
Yeah,
She's fine.
this is my normal because
If
I
she
talk.
does walk straight and she doesn't fall, then we're concerned.
Yeah, I
At
have
that point, she
yeah.
might have a couple of glasses of wine if she's walking straight.
Or have a brilliant, like, a string of, a chain of ideas,
Yeah.
and my midnight
I love it.
memos.
Yeah, yeah, that's when I get all the series of texts.
But
I love it.
reporting unsafe practice is not comfortable.
It is hard. It's hard.
It's not comfortable, and
It's
as a manager, it wasn't comfortable for me because I
having those
had much
conversations.
respect for this nurse. I had
Mhm.
mad respect for this
Yeah,
nurse,
yeah,
and that it's uncomfortable,
yeah.
but again, it's
It
not a
has to be
privilege to
done.
have.
Yeah,
Yeah,
yeah.
it's the patients.
Ethical failures would include falsifying documentation. That is
Mm,
like no
and
no upon no no upon no no.
and omission is part of that.
Yes, that I think no, it's not on here.
Omission,
Yeah.
lack
If
of
you
documenting.
didn't document the saying is if you didn't document it, it didn't happen.
But that's also falsifying documentation.
Yes.
I mean, I walked in one morning to a kid that was admitted for, I think, RSV, viral,
Mhm. Mhm.
upper respiratory. No vital signs have been reported for 16 hours. No pulse ox. No, the kid was on a monitor. It's not like they even had to get up.
Ay, ay, ay.
I know. So that right there, I should have reported it, but I didn't.
Yeah.
We just immediately went and got it, and
Mhm.
that's what nurses are good at.
Yep.
We're so good at
Let's fix the problem. Let's fix
yeah,
the problem.
and then you
So,
get so busy, you forget.
covering up
Yep,
mistakes,
and we're
not
and
reporting
that's called
unsafe practices.
it's not collusion if you don't purposefully know, is it?
I don't know.
Okay.
You know I barely speak English. Barely speak.
Lie. Patient
Patient
abandonment. This
abandonment.
was a big one with this
Mhm.
with
Yeah.
this
Yeah.
case with this
Yep.
our guest. And I didn't even that was the perspective I didn't even see. I
Uh-huh.
didn't see this coming at me
Mhm.
whatsoever.
So, a lot of cases start with maybe poor judgment or maybe fear.
Lack of knowledge. You
Lack
remember
of knowledge as a
she
new
did
grad. You might not even know you're doing something
yeah, so
wrong.
she didn't even know the lines were lined with lead.
Yeah.
So I mean, not
Yeah.
knowing.
It is not, I would say, very few. I would hope, let me say, I hope very few of these cases are actually intentionally mean at the
Yeah.
root of it. Like, I don't think many of them are truly have bad intentions.
Well, so far I'm in that Lucy Letby case, and for
Mhm.
England, so far, like literally, she is the common thread. But then I've seen kind of clips of what's to come,
Yeah.
and I'm like, oh my god! So
You
I'll
gotta
report.
send this stuff to me.
Yeah, I feel like we should do like a I hate to do this because I feel like we're just highlighting bad stuff, but I feel like
I
it's a
think it's
learning
educational,
opportunity.
yeah.
Yeah, so I feel like we could do our own like crime junkie podcast.
Like a book club, but podcast version? Okay,
Yeah,
okay.
like
Maybe we could do that over the
yeah, like,
summer.
issues and stuff
Yeah.
like this. Yeah,
Hot topic stuff, yeah.
Case studies.
There we go.
Oh my gosh,
See?
new series coming at you.
Brilliant idea.
Oh, we're so good.
So,
How do we protect ourselves? Follow policy.
follow policy, follow the law, follow your gut.
Oh my gosh, that was the number one thing she kept
Yes,
saying.
follow
Number
your
one
gut
thing.
because your license
Mhm.
belongs to you, nobody else.
And you are.
Nobody else is going to look out for you. I can't tell you how many times I personally have had to stand up for myself, which is scary because I'm not a stand up for myself kind of person.
No,
You
you're
know that.
not.
Um, I have been in like root cause analysis situations where other nurses are trying to throw you under the bus, and it's like the words can't come out of your mouth at first, and then it's like, wait a minute, I'm the one that documented. Like you're the reason we're here.
And and it all falls on the
Yeah.
nurse. There could be a chain, which we're going to
Mhm.
show. There could be a chain of events
Mhm.
with it very interdepartmentally or
Mhm.
intra whatever.
Yeah.
Very many people had their hand, but yet
It
it's
was the
you.
nurse.
You
Yep.
are the driver of
Mhm.
the boat.
Yeah.
Unfortunately, not the physician.
Yeah.
Not the physician.
Yeah. Let me think about that for a minute. The driver of the boat.
I always say I'm the captain of the cruise ship when I'm at work because we're gonna make sure they get their food, we make sure they're
Yeah.
clean, they're bathed,
Okay.
we do the
I can
orders,
see
we
that.
answer all the phone calls, we educate our patients, we teach our patients, we provide care for our patients, we
Yeah.
anticipate what our patients need. We give them medications. We call the pharmacy if
Okay.
there's not enough medications. We label the medications if they're not
I
labeled.
think I like your analogy, but I don't think you're the captain.
I'm not the
I
captain. I
think
said I
you're
was the driver. I'm driving
the
the boat.
captain drives the boat.
No, I feel like the captain sits
I
in the
think you're
chair
the
behind me.
director. I think you're the cruise ship
I
director.
don't know. No, no.
Yeah.
I'm driving the boat.
I don't think so.
Okay.
Because you still have to follow the orders
I am following the
or
orders.
refuse. So I think they're the driver. I think we're going to have to think about this analogy
Yeah, so let's look up what a cruise ship captain
versus
and the director.
yeah,
I
that's
mean,
funny.
I am an I, so it would make sense that I would be the party captain, but still,
That's funny.
I feel like I'm the one handling all of the instrumentation.
Yeah, which the cruise director, fun fact, they plan all the schedules, all of the you go here at this time, you go. That's who does all that.
And that's kind of what we do on a daily basis.
That's what I'm saying. You're the cruise ship director, not the captain.
But I'm driving the instrumentation that's being handled, i.e., given the meds.
Yeah.
The captain, I'm like on a Navy vessel.
Not a cruise ship, but a Navy
Okay,
vessel.
but just think about it. They're
I don't
standing
know.
behind you, and they're like,
I just don't want anyone to think that they
Scope of
supersede the
practice.
doctor. Yeah, the scope
Scope
of
of
practicing.
practice.
That's where my brain is.
I get that.
And maybe our brains are just,
No, I mean, I get that.
yeah,
I get that.
yeah. Anyways,
Side
one of
note,
our many tangents.
so what do you think? Are you the cruise ship director?
Yeah,
Or
let
are you
us know. Are you the captain or the cruise ship director?
And if South Carolina gets autonomy for MPs,
Oh
then you will
gosh.
be the captain.
Remind me of that after this because I have a story for you.
Okay.
But truly, the takeaway here is your license belongs to you. Your employer doesn't hold your license. They don't protect it. They're going to protect themselves.
Exactly.
And that's,
And they
I
tell you
say that very neutrally. I don't say that to scare you. I mean, they have things to uphold as well. It's all like, I don't think checks and balances is the right word, but we all have to look out for ourselves,
They got to stay
for
open.
different reasons.
They have to keep the doors open.
Yes, absolutely.
Um,
So, I mean, there are reasons why they don't protect you. That would be like a conflict of interest almost. So you are accountable for your own actions. That is the exclamation point, exclamation point, exclamation point today. You have to be accountable. And
know what you're getting into.
yes,
I
yes, and
always
just be smart.
tell, medication administration policies or blood administration policies vary. Literally, there's not a standardized protocol. They vary from organization to
Yeah,
one
which is
organization
fascinating.
says you have to give the blood within 15 minutes.
Mhm.
Another organization I work for says 30 minutes.
Mhm.
So know what,
Your
just like
policy,
you
yeah.
said, print those friggin'
Have your little
policies out.
binder.
Yeah.
So the last segment of this episode, I feel like we've been long-winded today.
Yeah, we have.
But this is a big one. This is a big
I
one.
mean, we're passionate about this.
Yeah, we are. And it's
Because
important.
we even had that conversation of, should we talk about this?
I know.
Because we don't want to scare our
Ooh.
students. There's scaring and then keeping
Empowering.
Yeah. Oh,
Yes.
that's a good word.
Empowering.
That's a good word.
Yeah.
Good word.
So ways
Empowered.
to
Powered up.
powered up. See, we just were like foreshadowing.
There you
Oh,
go.
it's amazing.
There you go.
So
Chapter.
I think at this point you're probably thinking, or hopefully you're thinking, well, what should I do to protect myself? How can I protect myself? You just scared the snot out of me. Now what do I do?
Mm-hmm.
And I think it comes back to the things that we've kind of already said. So you need to know your scope and your job description. What is your role? What are others' roles around you? Because you are responsible for delegation, and you can't delegate to someone else and not hold accountability for them.
Simple analogy. In the ER, we gave all of our own inhalational therapies, treatments, breathing treatments.
Yeah,
On the floor, respiratory therapy has to do it.
does it. So know those things.
Yeah.
Know those little things.
There's always going to be little caveats, no matter where you go, that are going to differ.
Yes. Which, floating to other units. Be very cautious. I personally never did it because I didn't have the confidence, and I look back and I think, oh, thank goodness you didn't have the confidence.
Like brand new nurses being put in a float
Yes,
pool
a
and
float
a
pool
new graduate
is a lot.
Scares me.
It's a lot. You have to know even just the dynamics of that
Dr.
group.
C told us a story about she was in the float pool at a hospital.
Oh, yeah.
And
She's personally dealt with stuff.
She was put in charge, and she didn't
Yeah.
know this. It had nothing to do with
Yeah.
patients,
Mm-hmm.
but an administrative policy.
Yeah. So you have to know those small little caveats to each unit, even knowing, I mean, your unit is like your family, even knowing the personalities on the unit.
I do tell our new guys that you're going to spend more time with your work
Mhm.
family than you are going to be.
Yeah.
Because everyone thinks we work 12 days a month.
Mm-hmm.
Okay.
I mean, true.
I'm here to tell you,
You
it
are
doesn't feel
tight-knit.
like that.
Mm-hmm.
It doesn't. It feels harder.
Yeah, a lot more. So I think our guests touched on things like we all have our skills, things that we're good at, things that we're not good at, patients that we're really good at managing and handling, even just personality-wise, not just case, but personality-wise. And that plays a role into your day if you, as like a charge nurse, can delegate those patients accordingly. We talked about delegation mistakes, being asked to help out, quote unquote, help out. Like things, if you don't feel good about helping out, don't help out.
Yeah.
You know?
Yeah.
Um, so definitely don't practice outside of your scope. Be extra cautious posting anything on social
Social
media.
media is good and bad,
It is good and it is bad.
but
You definitely have to have digital professionalism.
and I can't wait to get our HR guest in here. He texted
Yeah.
me the other day, so
Beautiful.
he's really is gonna tell us what they
Mhm.
really do look
Look
like,
for.
and I'm gonna tell you
I'm so
people,
excited.
I'm like, I thought it
Yeah.
was just tattoos.
Yeah.
Like
Yeah.
or when people started, really
Mhm.
doing sleeves and stuff. I mean, there is a generation that is kind of,
Disagrees with that.
yeah, they didn't
Mhm.
want those people with those tattoos taking care of them.
So be very cautious to not break HIPAA.
HIPAA's huge,
Be
and you don't understand how close you can come. Like again, we question some of the
Yeah.
when we talk about things in our
Yeah,
past.
we go back to HIPAA all the time and break it down. Okay, did we say that right? Did we
It
I
anyway,
edit stuff
could
out
anyone
constantly.
figure out? I
Yeah.
always think if it's a patient I took care of, can they figure out that I'm talking about
Mhm.
them?
Mhm.
So it is because again, we've been sitting in those
Mhm.
witness boxes
Mhm.
before, and having to answer to a defense attorney, it is it's not comfortable.
Yeah,
It's very
for
uncomfortable.
sure, definitely. Posting about your employer, your
Uh,
job, venting online isn't professional.
mm-mm.
Um, Making your account private, you're putting it out to the World Wide Web. Nothing's private.
Nothing's
Nothing's
private.
private.
Nothing.
I mean, I truly believe, like, if you wanted to know my Social Security number, you can find like, it's just
Here, take my
everything.
identity. It's
Yeah.
fine. No, I'm
Yeah, we
good.
hear about this stuff all the
I'll
time.
come
So,
back as a
just because
no.
your account is private doesn't mean anything.
It's not
Doesn't
safe.
mean anything.
It's not safe.
So, always question, what would the Board of Nursing think about this before you post it?
And check in on the site. The only
Yeah,
times you really go to the site
is when
is
you
to
submit
renew
your
your
yeah.
license. Go in there and look around. Like I spent an entire day looking at disciplinary reports.
Mhm.
And I was like, "Oh my god, they got oh my god. No.
Nuh-uh.
That's scary."
Yeah.
I mean, it is really imperative. We tell our students to begin with, you can have a degree, but if you don't pass that NCLEX, you can't practice. What we don't say to them is you
You have
have
to
got to
maintain your
protect
license.
it.
Yes.
You work too
Yes.
hard to get it. You have got to practice keeping it safe.
Yeah.
And that means practicing safely.
Yes. And a huge part of that comes down to documentation, whether we like it or not.
And they don't
Not
make
just
it
what we do.
and we're not even gonna start the argument of how even though we EHRs were supposed to be the answer
Mhm.
to all, we know it's still cumbersome and
Yeah. It
difficult.
is difficult.
Dupli du duplic no, du you
Complex? What do you
no, you end up double
double
they tried
document?
to
Yeah,
take
yeah, yeah, yeah.
away the double documentation
Mhm.
issues, but it's still there.
Yeah, it happens. So I think I challenge you to reframe your mindset around documentation. Think about it as a tool to aid in communication.
Yeah, just think about if you're gonna be called into court.
Yeah. But like even amongst from one nurse to the next, like if you're doing shift change, that nurse should be able to get a clear picture of what happened on the shift before. You need to
Exactly.
communicate that eloquently, that they can say, "Oh, okay, now I see why
Well,
that
4 hours
medication
to
got
go.
pushed back
Yeah.
30 minutes." They need to understand, not just read and be like, "Okay, that happened," but understand why it happened.
Mhm.
You should use it as a patient safety tool. You should use it as legal protection, definitely for sure,
Mhm.
and communicate your ethical responsibility
Mhm.
through your documentation. We've said if
And
it
document professionally, though,
professionally, not what's the word, bias, not
not subjective. You
yes,
need to
very
chart
objectively.
objectively.
Yes,
There should be no personal
that can be
pronoun
hard.
use whatsoever.
That can be hard.
I know, but,
But you're not the
I
patient. Yeah.
yeah,
Mhm.
and, if you because that means you're not bringing your biasness into
Mhm.
that documentation, which you shouldn't.
Right.
Again, which that could creep over into, what was we were talking about, beneficence
Right.
versus our
Non-maleficence.
belief.
Yep.
Yeah, yeah,
Yeah.
so
Yeah, true. So I challenge you to reflect a little bit after this episode. It was heavy.
Yeah.
It's a heavier episode. It's not us cracking up and talking about fun stuff, unfortunately. We have our moments where
But
we can be
it's gonna feed
serious.
into the greater good,
Yes,
and
it
I think it's
does.
really important to understand all of this because as we start to unfold the case, which is coming next,
Mhm,
right?
mhm.
You'll understand some of these principles that really kind of were blurry, were
Mhm.
black and white, were gray, what
Right,
and why. So
right,
I think it's imperative you understand the core of the actual case.
right. Yeah. So we'll yeah, that's coming. I think, like I said, I challenge you to take this time to reflect. Maybe think about ethical situations where you would feel most uncomfortable standing up for yourself or your patient or whatever it may be, and kind of practice them maybe,
And know
like
what your ethical like, if you have an
your
ethic
implicit bias.
well, know what to do about it.
Yeah,
So we
it's
there
hard.
was a time when, the nurses on my floor, there was something happening, and none of us felt comfortable doing what we had to do, and so we took it to our ethic board.
Yeah, which
And
every
that's scary,
hospital
yes,
has an
and
ethics
it's
committee.
no one really you click through it in your
Uh-huh.
annual training,
Yeah,
but no one really knows the process and
yeah,
the steps,
like
which is part of what's coming because that was
yes,
one of the key things that our guest
yes.
talked about was, "Okay, now what do I do now?"
Mhm.
You know?
Yeah.
So, I think that's we're gonna bring that in, so
Mm,
but you needed to understand that whole
so fun.
all
We
of
got a
that.
lot on the horizon.
I
This is
mean,
gonna
it
be
is
good.
we thought it was just gonna be an hour interview.
It's not.
It
I guarantee you it's not. Like, there's no way.
Like,
It's too good.
when I watched the first time, you remember I kept coming to your office, like, every 10 minutes going, "Oh
"Oh,
my
look at
god,
this.
look what"
Did you know this? Read this."
so many bombs
Yes.
that
So,
hit me.
final message. Ethical nursing means safe nursing and also license protection. So
Yep.
think about that every moment that you practice, not to scare you, but just to make you more aware and empower your nursing skills because we truly think we have some fabulous nurses, like
Oh,
exceptional
yes.
nurses. And I think our guest is truly a fabulous
Oh,
nurse.
I
It
do
was just a
too.
situation of unfortunate events. And
I
so
can't
I
wait to
think
ask her my
that's a
questions.
huge thing. Yes. So look forward to what's to come.
Stay tuned.
Stay
Absolutely.
tuned. Yeah.
Stay tuned because I'm telling you guys, this is so big and
So
so
fun.
worth it.
Yes, yes, yes,
So
yes.
worth it.
So, as always, follow us on all of our social media outlets. Listen to us weekly on Wednesdays. And
Thanks
thanks
for
for
scrubbing
scrubbing in.
in.